Hello, everyone, and welcome to our webinar today. My name is Jonathan Adkins. I have the pleasure and honor of being the Chief Executive Officer of the Governor's Highway Safety Association. Really happy that you've been able to join us for this session on post-crash care today. Sometimes it may feel like post-crash care is sort of the forgotten piece of the safe system, comprehensive approach to safety. But I don't think that's true anymore. It is a priority for NHTSA. It's a priority for the Governor's Highway Safety Association. And it's a priority for you because you're on this session today. There are a lot of you that have registered. I know we did this webinar with some short notice. We wanted to get this great content out and these ideas for things that are fundable in advance of the Safe Streets for All grant deadline, which is quickly approaching. And then we have the August 1 deadline for state highway safety officers to turn in their grant applications for NHTSA. So we wanted to get this information out there to you. And I know you're anxious to hear about some of the examples and to have some dialogue. And so I'm going to quickly move on to introducing our two speakers and turn it over to them. Our first panelist is Daniel Zimmerman. Daniel is the Senior Director of Government Relations here at GHSA. He is an expert in post-crash care and has been involved in our partnerships across the country working on this topic. Our other panelist is Chuck DeWeese. Many of you may know Chuck. Chuck is the president of Connecting Clients Consulting based in Albany, New York. He's been in the field. I'm not going to say how many years because he'll probably get mad at me, but he's been around for a long time. He has served at the Highway Safety Office Director level and was also a past chair of GHSA. He has attended a variety of sessions and is also an expert on post-crash care for GHSA. And so with that, I'm going to go ahead and turn it over to Daniel and Chuck so we can get right into it.
Great. Thank you, Jonathan. So I want to just dive in initially on a little bit of background about what post-crash care is, why it matters, and what are some of the areas that highway safety offices can really engage to improve this. And then Chuck will go on to share some more about some key takeaways from a conversations we had at a gathering with EMS, highway safety offices, and other safety stakeholders around improving post-crash care and what highway safety offices can do to do that. So to start out, want to share just a couple of stats about post-crash care. I'm assuming since you've joined us today, you're already sold on the idea that it's an important element, but just in case. So the first is, I think, is a really a staggering number that 42% of crash victims were alive at the time that EMS arrived, but later died. If we think about that number and look at the overall fatalities, this represents a really significant portion of those fatalities and a real opportunity to save more lives. We of course want to prevent the crash from occurring altogether, but when it does occur, it's important that we're able to save as many of those crash victims as possible. I think even more interestingly, or maybe more staggering, is that of the crashes that involve children, the statistics are even higher. So 55% of children that died in crashes were alive at the time that EMS survived. So it's 42% for adults and 55% children. So really represents a large area of potential improvement and a real opportunity for us to save lives. So with that in mind, what really is post-crash care is sort of the initial question here. And it's a vital piece of the SAFE system. And as Jonathan mentioned, often references under prioritized, though I would say the tides are changing on that for good reason. But it's an important piece of the SAFE system approach. And really the objective is that when those crashes occur, how can we intervene to improve the survivability? So there's a number of elements that we'll talk about that go into that. But really, that's the key piece here is what can we do to make sure that EMS is providing quality care in a timely manner and in the right place and getting folks to the right locations. Again, this goes back to when crashes do occur because we're trying to prevent those, how do we interject? So the primary components of post-crash care. If you think about when a crash occurs, first step is making sure that the appropriate entities know that that crash has occurred so that we can dispatch emergency medical services. So traditionally, the most common thing that folks think there is 911, which is of course important and a vital piece. But also there's technology, whether it's in vehicle or on the road technology, that can help identify when crashes occur and cut down on the amount of time from when that initial dispatch of emergency services occurs. The next component is timely on-scene care. So once we know that the emergency services have been dispatched, how quickly can those get to the scene of the crime or scene of the crash and be able to intervene and administer life-saving treatment? And the obvious here, timely EMS service, but also you have to think about law enforcement and their opportunity to potentially engage and administer services to that crash victim prior to EMS arriving. Oftentimes, law enforcement are on the scenes of crashes before EMS get there. And so what interventions, within their training can they do to help prolong the life and improve survivability of any of those crash victims until EMS can arrive? And then the next piece, so we had the initial dispatch. There's timely on-scene care, and then the final component from the post-crash care side is transporting them as quickly as possible to a quality trauma center that has the right equipment, the right staff in place, and the right training to address the type of trauma, the type of injuries that crash victim has. And so this is an area that there's a number of things that can be done. So in rural areas, for example, there might not be the level of trauma center that is ideal. And so making sure that EMS is able to get those individuals to the right place that has the right services and equipment and technology available to help those victims. And then finally, the last is quality data around all of the above here so that these areas can continue to be improved and be more strategic about the allocation of resources and look at ways that we can really impact how we are improving post-crash care. So with all these elements in mind, I'll turn it over to Chuck, and he's going to jump into some of the areas of concern or challenges we've seen and how state highway safety offices can intervene and assist with those.
Great. Thank you very much, Daniel. And it's a pleasure to be with all of you today. First, I want to thank Jonathan and GHSA for asking me to be a presenter on this webinar and also to be a participant last August during the first ever post-crash care summit. I left there with all kinds of information that we're going to share with you today. And when I left there last year, I said to myself, boy, I really wish that they had had this summit 10 or 15 years ago, because as a highway safety office director, we always knew we should be doing something in the post-crash care field, but really weren't sure how to start. So I'm going to walk through some of the concerns that we heard at the summit and give you 6 or 7 or 8 things that you can walk away with today that you can start implementing immediately in your state highway safety office. So the first concern that we heard during the summit was, I don't know who the post-crash care folks are in my state. So I think one of the first things you can do is to convene meetings with these folks, your EMS folks, your 911 offices, trauma centers, and first responders, and build a relationship with them, because then you get to know what their needs are and what opportunities you have to fund some of their projects. And you want to make sure you include post-crash care in your 3 HSP in your plan development meetings. Bring these folks into these planning discussions and even consider hiring a post-crash care liaison. We have LELs and TSRPs and JOLs. Consider hiring a post-crash care liaison that can liaison with those entities. And you'll hear later that Washington, D.C. and Rick Burt's office has done just that. The second concern that we heard during the summit was, boy, the data is really poor. There's poor data quality and linkages between the different EMS and post-crash care systems. So we have a solution to that, right? We have our traffic records coordinating committees, but how many of us have post-crash care entities that are sitting at that table? So if you want to improve the completeness, the timeliness, the uniformity, and the integration of those systems, invite them to your TRCC meetings, and you might find out that there are ways that the Highway Safety Office can help fund programs to improve that data quality. The third concern that we heard at the summit was about post-crash survivability. And there are countermeasures that exist to improve that survivability, but they're not being utilized. And Daniel's going to talk a little bit more about this in future slides. But at this summit, we heard from folks from the military, and it was shocking for me to hear that you're more likely to survive in a war zone after being injured than you are from a motor vehicle crash, because in the military, they actually transfuse the victims with whole blood, pre-hospital blood. And there's opportunities for our EMS community, instead of using saline when they get to a crash site, to actually have pre-hospital blood, whole blood, that they can transfuse into the patients, which has life-saving abilities with it. Next slide. Next, we heard about inadequate protections for our first responders. We know this, right? How often do we hear that our first responders are being hit, injured, or even killed on our roadways when responding to crash scenes? So the highway safety offices, and many are already doing this, can protect first responders by funding the digital alert technologies. You probably heard of Haas Alert. They've been at the GHSA annual meeting, and there's others, to outfit workers with reflective gear and put these technologies in these vehicles so that cars are warned downstream from a crash that there is a crash and that they should start slowing down and moving over. And we all have move over campaigns that we do in our state, but we can amplify that messaging and try to help protect this community in our states. The next concern, we heard this loud and clear from everybody in the post-crash care community. They just don't have enough resources. There's not enough 911 operators. There's not enough EMTs. I mean, can you imagine having a situation where you need a 911 operator and nobody answers the phone? They don't have the resources that they need. They're severely underfunded in states. So opportunities exist for your highway safety office to bring these folks together and help fund some 911 call centers, to fund paramedics in hospitals and trauma centers. And of course, with all of these countermeasures, you need to talk to your NHTSA regional offices to see if proportional funding is appropriate versus funding 100%, because they may be, you may be funding positions that aren't necessarily always responding to just car crashes. They could be responding to gunshots and things like that as well. But so you need to talk to your regional office about proportional funding. The next concern, insufficient training for law enforcement and the general public. We do a lot of training for law enforcement in our state highway safety offices, but how many state highway safety offices are providing training to law enforcement for CPR or stop the bleed training, and extending that training to the general public so that when there is a crash and before EMS can respond to the scene, bystanders can help stop the bleed and perform CPR to give that life-saving aid to a crash victim prior to the EMS arrivals on the scene. The next concern is a lack of a national inventory of EMS helicopter operators and an inventory listing safe landing clearing zones. So when you think about, you call 911, what they're doing is trying to find out where the closest trauma centers are, and if a helicopter needs to be brought to the scene. Can you help fund programs that can build databases of who those emergency helicopter operators are, so that the 911 dispatchers have them right there at the ready so that they can dispatch a helicopter? And in addition to that, where are the safe landing zones in your state where helicopters can safely land, so you can speed up that response time to a crash? So the highway safety offices can, obviously with their funds, can fund projects that create these resources to that community. And then finally, inadequate funding for next generation 911 systems. I believe that almost all states have started or have completed implementation of next gen 911 systems. But if your state hasn't completed their installation of the next gen 911, consider proportional funding to fully implement that next gen 911 system in your state if it's not currently in place. So now we're going to talk about a few of our partner states that have implemented some post-crash care grant funding opportunities in their states. And the first is California. What they did is they funded a regional crash response and extrication improvement program, basically funding and supporting the purchase of extrication equipment for first responders. That equipment is not cheap, but it's needed to remove victims from car crashes in a timely fashion so that they can be transported quickly to a trauma center, as well as supporting the training and education that goes with that, the use of that equipment, and providing traffic safety education to the public. The next state is the state of Maine, where they are doing an analysis project where they're looking at when lights and sirens are associated with a higher risk of crash involvement. This was kind of something new to me, but they're looking to research whether or not if you do use lights and sirens, if it's really needed, or is it more detrimental and causes more crashes? So they're conducting a research project to determine when lights and sirens are actually needed and when they're better off not to be turned on. And then also in Maine and the state of Pennsylvania, they use their 405H funding to equip EMS vehicles with that digital alert technology that I spoke of earlier. That's when it's activated, it alerts drivers downstream that emergency vehicles are ahead. So that technology is something that's been fairly new in the industry for about the past 5 years. So you can fund those programs to equip vehicles, the EMS vehicles, with these transponders. And then also in Maine, over 250 ambulances in the state of Maine now have high-speed internet access, which is very important in a rural state, which allows for the transmission of data to their state DOTs so that they can activate the variable message boards that a crash is ahead. The state of Minnesota, under Mike Hansen, they have a very robust data analytics center out there, and they did a traffic incident and dispatch mapping project. And basically, what that did is they looked at where their most serious crashes were occurring in their state, and then they looked at the distance it was to the nearest EMS center. So by overlaying those severe and fatal crashes with the current EMS locations, they undertook an analysis to review the duration and distance from the crash to the closest EMS center. And what resulted from that was they created 30 new optimal EMS locations that would reduce response times to the crash scenes. Minnesota also did a data linkage project. They utilized their data analytics center to link 3 different separate data sets together: their EMT run reports, their emergency department admission reports, and discharge reports. They wanted to link that data together so that they can get robust data from that to identify where their problems exist and how they can be remediated. The District of Columbia, as I said before, hired a post-crash care liaison. As far as I know, it's the first state in the nation to do that. And their single role is to meet with the EMS community, build those relationships, and how we can best collaborate with a group of folks that we typically don't collaborate with. So if it's dedicated to one individual, one FTE in your office, you'll expand those relationships with those organizations. And they institutionalize post-crash care in the State Highway Safety Office as part of the safe system approach. And then Pennsylvania, they conducted an EMS response time project, and this was a 405C traffic records project that was funded to map out locations where response times did not play a role in the survivability, to see what engineering and educational strategies are needed in those areas to prevent future crashes. And they're looking at additional opportunities to proactively help communities with resources to prevent crashes. And then I think the next slide is the last one for states here. Pennsylvania, under Tom Glass, they produce a FARS quarterly newsletter, the Fatal Accident Reporting System quarterly newsletter. And they published the crash scene, it's called, to improve communication and collaboration between the Highway Safety Office and their state medical examiners, their coroners, and their EMS providers. So it's a way to improve that collaboration and that communication with a community that we haven't really partnered with much over the years. And the goal is to highlight the purpose of quality and timely data and how the data is used to drive policy in the State Highway Safety Office. Next slide. And now I'll turn it back to Daniel to cover a little bit more on that pre-hospital blood we talked about.
Thanks, Chuck. Yeah, as Chuck mentioned, pre-hospital blood is an area where there's a lot of opportunity for saving those crash victims once EMS arrives on the scene. And what a pre-hospital blood program is a transfusion program that really enables EMS to provide that whole blood as opposed to other saline or other solutions. And this is something that we've seen, it's been used for years in a military application, and there's been a lot of successes there, but there's much more limited deployment when it comes to civilian EMS services. There's a handful of EMS agencies out there that are doing this and other places that are piloting it, but there's a lot of opportunity to expand the access to this pre-hospital blood. And it truly is the research shows it has a lot of potential benefit for saving lives. Research has shown that pre-hospital blood can provide a 37% reduction in the 30-day mortality. So there's a lot of opportunity there. And Washington, D.C. has had some success in this over the past year. They've been undergoing a pilot where they had 6 different traffic-related incidents where pre-hospital blood was administered, and of those 6, 4 of those individuals survived that otherwise wouldn't have. And if you think of the total number of fatalities in DC, they had 44 in 2023. It's a significant portion that were impacted. And so we're able to continue to expand access to programs like these, going to have a real impact on the post-crash care side of it. So what is included in a pre-hospital blood program? So you're looking to help assist if a highway safety officer is standing one of these up. There are a couple different areas or all of the above that you could participate in helping to support. The first is establishing a stakeholder committee. So community, regional, and hospital blood banks, hospital administrators, EMS, state and local EMS medical directors, trauma and ENR personnel, and state agencies with jurisdictional authority to provide initial and ongoing input into the process. So all of those folks are important to coming to the table. There's some logistical hurdles to sort out and potentially some regulatory ones, but that cross-section of individuals could really help make sure that you have all the right information and the right players at the table. The next is tackling the issue of a blood sharing network. So across the country, blood is often in short supply, and one crash patient can require as many as 100 units of blood. So working with regional hospitals and regional blood banks to ensure that there's adequate blood supply, and that all of these different pieces within the system are connected and talking to each other to make sure that when EMS needs whole blood, that they have access to it, and it's also not, vice versa, impacting the supply levels for the blood banks. The next element is equipment. So, in addition to the actual blood itself, you need the equipment to properly store and transport it, and then rewarm and administer it to those crash victims. So that's another area where that some additional setup is needed in order to establish these programs. Education and training is needed. Making sure that EMS and others have scientific literature to support the value of the programs, as well as the necessary training to actually administer whole blood and make sure that it's being used as effectively as possible in order to save the lives of those crash victims. So this could involve creating a pre-hospital blood administration training curriculum or working to help support clinicians with getting the appropriate training there. The next is the appropriate data and quality improvement. So again, once we've stood this program up and are working on it, making sure that we're collecting data that helps support how to continue to improve it, how to best use the resources available, and ensuring that that data is available to the full stakeholder committee and other stakeholders in the space so that they have the information they need. And then finally, the guidelines are an important piece of these pre-hospital blood programs, making sure that there's formal documentation so that there are locally compliant processes and criteria for paramedics who are participating in pre-hospital blood transfusions. So things like how to store, package, transport, and resupply on blood, and then how to dispose of any unused blood, and making sure that they have all that information available so that they can effectively implement these programs. This is an area of the pre-hospital blood that GHSA thinks there's a lot of opportunity in. Some states ran into challenges being able to get support for 402 funding projects under this during the last AGA round. If this isn't something that your state is interested in doing, GHSA is more than happy to work with you to try and figure out a path forward with 402 funding to support a project like this. So please reach out to me if you have any concerns or interest in doing it. We'd love to work with you on it. All right, with that in mind, we'd love to answer some questions. Chuck, I have one initially for you here. I'm curious about, seeing that we heard there's a lot of information that was shared here, went through a lot of different examples. If a state has done nothing in the post-crash care realm before, what would you say the first step is they can take, or what's one initial kind of bite at the apple they can do to approach this? Chuck, you're muted.
I apologize. Coming from the sitting in a highway safety office for 15 years, there's a lot of work, right? We're working on our AGAs, we're working on our annual reports, we're working on everything to keep the boat from sinking. So I think that the most important thing is to develop relationships with the post-crash care community. And in order to do that, I love the idea of hiring that post-crash care liaison. Give it to somebody in your office that has the time to do it, that can build those relationships. If we think we're going to do it and things are going to come up where we just don't, it's going to take a back burner. So if you really want to start a program, I think building those relationships, inviting them to your traffic records coordinating council meetings, the development of your highway safety plan and your AGA, in your state highway safety plans. But you really have to build that relationship, find out who they are, introduce yourselves, and start a relationship.
Great. Another question here. So there are currently no post-crash care countermeasures, and it says countermeasures that work guidebook. Is this expected to change and to help states know which countermeasures are effective?
Yeah, that's a great question. We brought this up at the summit last year because we use the countermeasures that work as a kind of our Bible when we're writing our highway safety plans and our AGAs. And there are currently no countermeasures that work that have been developed for state highway safety offices, but GHSA will be working with NHTSA and their EMS office to try to develop some of these helpful countermeasures so that states will have a guidebook to go by with programs that work.
Great. Another question here. So does 402 funding fund post-crash care programs such as Stop the Bleed educational efforts and blood sharing demonstration projects? And are there any other sources of funding out there?
So, I mean, I would always say make sure you reach out to your regional office, right? That's the guidance we've heard for years. Reach out to your regional office to make sure that 402 funds can be used. But if they can't, there's also, Jonathan mentioned the Safe Streets for All grants. That application is open right now and it closes, I believe, June 26th. So there's other opportunities for funding if 402 funds can't be used. But as Jonathan and Daniel both stated, NHTSA is actively pursuing post-crash care as one of the elements of the safe system approach. So we're hopeful that they're going to allow states to use their highway safety funds to fund these critical life-saving programs.
Yeah, and I'll just add on to that, from our interpretation of 402, these things are eligible. So if you're running into any challenges, again, please reach out so we can help you navigate that with getting approval for those. All right, another question here. With trauma center and EMS personnel shortages, funding issues, and other competing priorities, how do we get these and other partners talking about post-crash care?
It's a great question. I mean, I go back to building the relationships. If you don't have the relationships with that community, you'll never know what those problems are and what needs they have. When we have a traffic safety problem, whether it's a pedestrian safety problem or a motorcycle safety problem, we need to bring all the players to the table. You need to bring your engineers, your enforcement personnel, your highway safety office, but you need to start thinking about bringing the EMS community to these meetings as well, because they may have good advice on things that can be done to save these lives. Again, I never really thought about EMS as the highway safety office. I mean, I thought about it, but I was always like wondering, what could I do? Now we have some examples of some states that are funding some projects that are working. I really love the pre-hospital blood. I learned a lot about it. I mean, blood doesn't last forever, so you can't just keep it in an ambulance for like 6 months. You have to have a rotating program with it. So if you bring these people together in a room, they'll tell you what they need. And then if you have the funds available with your 402 funds, I highly encourage you to start at least one program in your state and maybe build from that in years subsequent after that.
Great. Another question here is, are there any examples of highway safety offices that have successfully helped fund 911 call centers, paramedics, etc.?
I am not aware. If there is somebody that's on the call that wants to put that into the chat, that was just a suggestion that came from the summit to do that. And again, I think it would have to be proportional funding because the 911 operators are responding to all types of different emergencies. But the folks that I talk to in the EMS community are struggling to staff those 911 centers. They're very underpaid positions in most states, and it's tough to get people to stay in those positions. A very stressful job. But if you bring those folks to the table, you might find out that you could proportionally fund a position to help them out a little bit.
Yeah, I would say the other thing that comes to mind too, if you're not able to specifically fund a position, is looking at ways that you can help the resources that those communities have go further. So thinking about, technology support for 911 centers to help them identify and find where crashes are occurring and more easily dispatch, or providing training to EMS providers, or even data analysis to help make sure that they're positioned sort of similar to the Minnesota example that Chuck shared. So I think, that's maybe another angle that could be taken to try and address that issue if you're not able to actually directly support positions. Being able to help them be more successful and remove some of the barriers for them to do their jobs. There's another question. It said, you mentioned that DC EMS gave whole blood after 6 crashes, and that 4 of the victims survived, who's otherwise wouldn't have. What indications do you have that the standard of care would not have been life-saving? So these are, when those determinations are made, it's based off of the medical personnel that are engaged and their kind of professional judgment on if that wasn't a necessary piece of saving life. All right, another question here. Are there any statistics on how bystander CPR or stop the bleed impacts survivability?
I don't know of stats on that. Again, that's why when you engage with that community, you probably learn those statistics. But I mean, just from a common sense standpoint, if somebody's bleeding out at a scene and a bystander can use a tourniquet of some type to stop that bleeding before the EMS arrives, or they can provide life-saving CPR. I'm sure there are statistics on that somewhere in the medical community. Daniel, I don't know if you're aware of any, but I'm sure we could probably find that information and send it out.
Yeah, I'm not aware of any specifically, but I know, I mean, there certainly is data that supports blood loss is the top contributor to death after trauma. And so any ways that you can slow that blood loss, then that's going to impact it. I mean, that's why pre-hospital blood is so impactful, is because that is the largest cause of death in trauma cases. And so things like stop the bleed help address that issue too, but just to a lesser degree.
Yeah, and I think law enforcement, if I'm not mistaken, probably does have tourniquets. I remember talking after the summit last year that some people at the summit actually have them themselves. They keep them in their house or in their garage. God forbid you cut your arm or your leg while you're using a chainsaw or something like that. But I'm sure police have the need for tourniquets if they don't already have them, and that is something that I would think that 402 funds could be used to buy that equipment to help in car crashes to stop the bleed.
Yeah, John Nelson made a comment that in Missouri, state troopers are beginning to carry tourniquets on their person on a voluntary basis to administer in the event that they arrive on scene first before EMS. So that's another example there. All right, believe those are all the questions that have come in so far. Chuck, I'm curious while we give folks another minute here to ask questions. If you had any takeaways in terms of from those discussions last year around, who are the other entities specifically that are sort of counterparts within the state that a highway safety office could engage with as a good starting point with this?
Yeah, I mean, I think, I didn't know, and I don't know who they are. But that's a great question. I think you need to be active. You need to go out and start asking those questions of who they are, whether you're Googling it or you're asking your Department of Health counterparts. But who are the people we need to know? And just convene a meeting with all of those folks, and you'll start to learn, who runs the EMS offices, who runs the 911 centers, who's in charge of updating to the next gen 911 system. If you don't know who they are and you don't meet with them regularly, we'll never be able to join in partnership with them to try to solve these problems. But again, I was always kind of just scared to get into this field because I didn't know enough about it. And I think it's incumbent upon us at the highway safety offices to take that first step, because they're probably not going to come to us because they probably don't know who the highway safety office is and that we have grant funds. So we need to go out to them, maybe through your state police or your local police agencies or your TIMS teams. They may have relationships there. I know that I sat on our New York State TIMS group, and I was able to meet some of those folks through those meetings. But it was a once a year meeting, and you met them, you talked to them, and you left. But if I were in this role again today, I would actually try to pull all those partners together and have, quarterly meetings to try to figure out what their needs are so that we could try to come up with some grant opportunities to give them the resources that they need.
Great, thank you, Chuck. Two other quick notes that folks made here. So it was noted that some state highway patrol and law enforcement agencies are starting to carry AEDs in their vehicles in Kansas, and that Kansas DOT is also has a post-crash care liaison as of March of last year. So that comment was made, and then from DC, it was mentioned that they're always happy to talk more about their post-crash care liaison position as well. So both of those are great resources for states if they're interested in learning more about that.
Excellent. It's great to see that there's a second state that's taken that step to do that. We know how beneficial our LELs are and our TSRPs and our JOLs. It seems like we need a liaison for each of the different traffic safety areas, but it's what's needed to build those relationships. So congratulations to both Kansas and to DC for those positions.
Great. Well, those are all the questions I see. So with that in mind, just want to say that improving post-crash care provides an immense opportunity to save lives. And it's an arena that highway safety offices haven't traditionally played a huge role in. So we see a lot of life-saving potential here and are hoping that highway safety offices will dig into this and look for opportunities that you can use some of the actionable strategies and resources discussed today to help improve this. If you have any questions about the eligibility of a project for federal funding, like I said, please reach out to me. We'd love to work with you on that. And last but not least, we hope to see you at our annual meeting in August in Pittsburgh. They'll continue to have thoughtful conversations about topics in traffic safety like post-crash care. If you're interested, GHSA.org has more information on that.